podcast. I'm your host and founder of Shreya Wellness, Ashley Hendrickson. And today I have with me my friend who I'm very excited to introduce you all to. He is our partner practitioner serving as our chiropractor for Shreya Wellness, Dr. David Foss, the owner and founder of Vital Wellness Centers. Glad to have you here.
I'm happy to be on.
Yeah, I'm super excited to let everyone get to know you and what you do.
Excellent.
So why don't you start us off just by telling us a little bit about yourself?
Well, all right. Well, I've been at this now 20 years. I celebrated a 20-year anniversary, just a few weeks ago.
And, Congratulations.
Why, thanks.
I
know. It's crazy to think that it's been that long, but I've been doing this 20 years, and I guess another thing is that I belong to what's called the International Chiropractic Pediatric Association.
Okay.
So I really focus with families in pediatrics, and what else?
Well, what else? So your practice is Vital Wellness Centers.
Mm-hmm.
Where are you located?
I'm located in Elburn, Illinois, which is about 45 miles west of the city. It's a little small town. It's my speed. I like it. It reminds me of my hometown back in Iowa. So, we got the pulse of the city because the train, the metro comes out here.
Right.
But it's far enough away, and there's cornfields, and it's small town feel, so it's pretty nice.
I love it out here. You may notice that we're in a different setting today, and that's because I came out to Vital Wellness Centers to see Dr. Foss in his location. Hopefully soon, within the next, 8 to 9 months, we'll all be under one roof in one particular place. But for now, we are working together as partners who are building a network to help you all get the services you need to get you healing and feeling well.
And that's, I guess, some of the reason why I built this place 5 years ago. This brand new, beautiful little location here with, we might be skipping ahead a bit.
That's
but,
okay. We can do whatever we want.
Do whatever we want. So when I made this place 5 years ago, I decided to put in a hyperbaric oxygen chamber and an infrared sauna. And we also have a cold laser to help assist people in their healing, and I suppose we can talk a little bit more about that later.
Yeah, absolutely.
Yeah.
So why don't you start off just by giving us a little bit of background into why you decided to become a chiropractor in the first place?
That's a pretty fun story.
I know it. So, I want all of them to hear it.
All right. So I was in college, and in college, somebody had told me to look into chiropractic because I was thinking about doing like sports medicine or physical therapy, and this friend of mine said, look into chiropractic, and I thought, all right, well, I'll take a look at it. And so I just knocked on this chiropractor's door, a little tiny town like Elburn here. It's a little town called Fayette, Iowa, and I knocked on his door and I said, hey, I'm thinking about being a chiropractor, what can I do? And he said, well, I do this class through the school, and you can get credits through the school. It's a pre-chiropractic class. I'll teach you what you're going to be learning during first trimester at Palmer, and you'll help me out here at the office. You'll get credits, and I'm like, happy day,
Great.
It's a pretty awesome opportunity. So I started working with him, and he taught me essentially the philosophy of chiropractic, the science of chiropractic, and how it worked. And I fell in love with it because I'm kind of a big science geek. So I had a biology major, and so I started learning this thing about the nervous system because he tells me that chiropractic is about the nervous system, and you keep the nerve channels open. And I'm like, oh, okay, that makes sense. The nerves go here and there, and then when you remove the interference from the nervous system through the adjustment, the brain connects to the body, and the body heals. And I'm like, all right. That's chiropractic? I had no idea, right? And so that part intrigued me. And being that I am who I am, I guess, I tend to, in high school as a kid, I don't like following like the leader.
Yeah.
I kind of like going my own little path. I don't like doing what everybody else does. I'm kind of people who call themselves rebels usually aren't the biggest rebels. But I think, I like to go by the beat of my own drum.
Yeah, I can identify with that for
sure. And then chiropractic came, and it was this like black sheep of the healthcare, right? And so I'm like, well, I'm kind of a black sheep. right? This is kind of intriguing. And so that was the other thing that really got me into chiropractic, is because it was just different.
An alternative.
Exactly. And then I started getting adjusted, and my allergies went away, and my tendonitis and my elbow went away, and all these things started, and I started getting straight A's, and like school became very easy, or just easier, right?
Sure.
Things were just clicking. And I'm like, why the heck doesn't everybody go to a chiropractor, right? And so that's what got me intrigued with chiropractic. And the thing that really gets me, that keeps me going, is this philosophy of chiropractic.
So can you talk a little bit? I mean, I'm sure we don't have all the time to give us everything, but in a nutshell,
Sure.
what would be your elevator pitch?
Sure. Well, as far as for like the philosophy part goes, the power that makes the body heals the body. Done.
Oh, that was easy.
So anyway, that's short enough, I guess. But that's essentially where it comes from. The power that makes the body heals the body. And so if we think, we're this amazing human being, and we went from one cell, and in 40 weeks we became 50 trillion cells inside of our mom's womb, right? Which
pretty
is
amazing.
Incredible. It's like
mind-blowing, actually. I always had a hard time in biology really wrapping my mind around that.
Yeah, you create yourself.
It's so weird.
From almost nothing, right?
Every day.
Every day. And starting from, the get-go was probably a magic moment. Let's hope that it was a magical moment,
right.
That conception, right? And then from one cell, 40 weeks, we turn into like 50 trillion cells with everything right there. And that power that created you, that infinite divine intelligence that created you from almost nothing, is the same power that heals you, and that power flows through the nervous system.
I love it.
So you just got to keep the nervous system clear.
Right. So Jamie and I were just talking on an earlier episode about awareness and healing, and I'm always saying we are what's in the way of our own healing.
Yeah.
Right?
Right.
So chiropractic is something I also don't understand why everyone's not participating in. It's out there, you guys,
Right.
and if you have not been to a chiropractor, I tell you, you really need to check it out.
It's like the best kept secret in healthcare.
I mean, I really think it is very vitally, no pun intended, important in maintaining longevity and vitality and really living into old age instead of just making it.
Just breathing.
Right.
Yeah.
So that kind of leads us into my next question, which is, how does it really help facilitate the healing? Now, I know you said it keeps the nervous system clear, but can you talk a little bit about what you mean when you say that?
Sure. Dead people don't heal, right?
True.
So the power that made the body heals the body,
Mm-hmm.
and it keeps you alive, and that life force, that innate intelligence flows through your nervous system. And then there's nothing that influences your nervous system and how it's able to communicate through the body more than spinal structure and spinal biomechanics.
Okay.
So how the spine is lined up, how it moves, the structure of the spine, right, influences the nervous system. So then therefore the spine influences how your body heals, because it's the nervous system that heals everything.
Okay.
And to kind of go a little deeper on that, like, we understand that because, like, if you cut a nerve to your tooth dies. Like, it doesn't,
right.
It dies.
You get a black tooth.
Right. Good. So, and if you were to cut the nerves to your heart would stop beating, and then you would,
right.
die. Mm-hmm. So it's this life force, this energy that flows through the nervous system that keeps the body alive, adapts it to its environment, and keeps your body healthy and regenerating.
So then what happens where the spine is in the way? Like, what is that called?
Right.
And can you talk about that?
That's called vertebral subluxation, or subluxation for short.
Yes. That's short.
Yeah.
Subluxation for short.
For short. So if we break it down, right, when you break things down, things get a little easier.
Yeah.
So sub is less, lux or lux is Latin for light.
Okay.
And ation, condition of subluxation.
Got it. So there's less light.
Yeah, less force, less energy that's flowing through your nervous system.
I don't like it. I prefer more light.
Well, yeah.
We have less light right now too, but
we'll work with it. Yeah.
Okay, so then if I come in and I have a subluxation,
sure.
How do you fix that?
That's where the chiropractic adjustment comes in.
All right.
So essentially, subluxation is when the spine gets misaligned, or if it gets stuck, then that creates interference in the nervous system. So the messages don't flow through as well. And it also causes what's called a stress response, or being stuck in a sympathetic nervous system response, which when the body is, or when the brain and nervous system are stuck in fight or flight,
Yes.
that's a stress response that's needed for adaptation, for survival. But if we're always in survival mindset and our body's physiology is always surviving and is always stressed, then it's not healing.
I love it. And they've heard me talk about it before, because that's part of my pillar of wellness is stress and identifying what the stressors are. And I oftentimes will say misalignments of the spine or subluxations are stressors. And we don't think about it that way because we think like mental, emotional stress. But it absolutely is going to keep you from healing, right? So we need to get back in alignment and have everything flowing.
So with what you were saying, kind of piggybacking off of that, there's, you know, 3 major stressors, and this kind of goes back to the philosophy of chiropractic, which is, again, what keeps me going, and it's the thing that doesn't change, and it's like the truth. So there's 3 major stresses that create this interference or disconnects in your body's ability to heal. One of them is physical stressors. So that would come in the form of subluxation, when there's like literally like physical roadblocks in your nervous system. And then there's emotional or mental stressors, which are more vibrational. So those emotional stressors create interference in your nervous system and create a stress response and throw off your hormones and immune system and digest and throw off everything, right? We know how powerful emotional stressors and mental stressors can be. And the last one is chemical stressors. So these toxicities that are in our environment that are everywhere, in medicine, in food, they're everywhere. And these things can create disconnects as well. So we've got mental, physical, and chemical, also known as the 3 T's in chiropractic: thoughts, traumas, toxins.
So you guys have been listening to Jamie and I for a while. You can probably understand why we are super excited to have Dr. Foss as part of Shreya Wellness, this collaborative that we've worked to build to bring you all of these healing modalities, because he is literally singing the same song we've been singing for the last however many weeks it's been. Kind of talking more about that stressor, what are some of the conditions that you really have success with in chiropractic?
Anxiety is a big one. That's something that people really don't think of right away when they think of chiropractic. They think of like back pain or neck pain or headaches, and we do a great job with those. But using chiropractic just for like pain, and specifically like back pain, would be kind of like buying a smartphone and using it just for its calculator.
Not the best use of a smartphone.
No, it's got a really good calculator. I mean, don't get me wrong. You can do all sorts of crazy stuff with that calculator. But to buy a smartphone, I mean, you can talk to Australia and video chat with grandma and, you know, across the country.
Right.
Emails, video. I mean, you can do everything on your smartphone. So that's kind of like, you know, your nervous system, your body can heal and can do crazy, just amazing things if we just, you know,
get out of the way.
Get out of the way. Yeah.
For
so,
sure.
What other things? Anxiety, ADHD, any kind of neurological issue, depression, post-concussion syndrome. So anything that has to do with this guy up here, chiropractic does a great job with, because spinal, again, nothing affects neurology more than spinal biomechanics.
Right.
But we do some other things, as I said, with myself, allergies.
Right.
So
how does that work?
Your nervous system directly controls the immune response. And also, if you're in a stress response, if you're in this fight or flight response, that suppresses your immune system. Correct. So it's less about viruses and bacteria that are out there that make us sick, which is one of the biggest misconceptions in the whole healthcare world, is that germs and viruses make us sick, and it's called the germ theory of disease, and it's inaccurate on its best day, and we'll just call it inaccurate. Inaccurate.
Misconception. Yes. I
Misconception.
Like that.
So it's more about your immune system and how your immune system is able to fight off and defend, you know, from the environmental stressors, right, and the viruses as well. And one good analogy is, you know, so subluxation can help suppress the nervous system. That's a physical stress.
Sure.
Emotional stresses suppress the nervous system, which would then suppress the immune system, and then chemical stressors suppress the immune system. So all of these three things suppressing the immune system make our bodies a ripe environment for viruses and bacteria to do their damage. They're more like scavengers than, say, causes and agents of sickness. They're just doing their job.
They're opportunistic.
Exactamundo.
Right.
Yeah.
And so we set up this perfect environment
Exactly.
for illness because we're not practicing what we need to practice to live from a place of wellness.
Exactly.
Right.
And so that's then another thing that chiropractic's really good at is people that have like allergies, which is an immune system imbalance, or weak immune systems. You know, Billy tends to get colds or they get sick all the time, or how people would say he picks up or catches everything. And again, it's not that he's catching these things, his body's just not
More
as strong.
susceptible.
Exactly.
Sure.
Exactly.
I would think too, at least in my experience, I believe that a good adjustment can definitely help improve digestion.
That's very true as well, because when the nervous system is in fight or flight mode, the digestive system takes a hit.
It just stops.
Exactly.
Right.
So yeah, things like constipation, diarrhea. Ooh, that brings me to another thing. It's called the gut-brain connection.
Oh, you guys didn't hear that yet, did you?
Probably not. So the gut-brain. So you can see how all these things really
They do.
flow
It all
together.
works together.
So the nerve that exits the top of the spine right here, called the vagus nerve, connects the brain to the gut. That is the gut-brain connection, and that's through the vagus nerve. And so if you have subluxation or misalignment right up here at the top of the spine, that's going to stress the vagus nerve, which is can affect your digestion, and then
I always talk about the vagus nerve when we're talking about belly breathing and shifting out of the sympathetic to the parasympathetic. And I always make this really ridiculous analogy that if we were cavemen and we broke our leg, our bodies would do absolutely nothing to heal that leg if it thought we were going to die tomorrow.
Right.
Because who cares if your leg works if you're dead?
Right.
Right? Same thing with digesting your food and healing an opened wound. Or
hormone balances, immune system, all of
things.
these things are directly related to the parasympathetic nervous system. And if that's being shut down because we're always in fight or flight, then all sorts of hell can break loose, really.
Right. So you've shared a lot about what conditions it can help support getting regular chiropractic care. What do you see most often in practice?
Honestly, anxiety.
Oh, that doesn't really surprise me right now, unfortunately.
But the funny thing is, though, is people don't come in here for that. They're coming in for headaches or for a pain issue, because again, we are conditioned little creatures on this earth, and we go, and that's kind of how we understand chiropractic to be, is pain-based, in which it does a great job, again. But when people start understanding that it's about the nervous system and calming the nervous system down and reconnecting to the nervous system, then we help a lot with anxiety. So that's what we're seeing a lot of lately, as well as the other pain issues. Because again, when you're in fight or flight, your body's not healing and regenerating, and so that's going to also cause tighter muscles, more inflammation, more constriction, and so the adjustments do a great job with that too.
Yeah, and you just started to talk about what I was thinking about asking you next was, can that anxiety and that stress tighten up your muscles and cause subluxation?
Exactly.
Right. So you've got a whole
they all feed each other, right?
Hamster wheel. What's your favorite adjustment?
The Atlas adjustment, of course.
Oh.
You just got to tap that Atlas.
Yeah,
that's
right?
all you got to do. Tap that Atlas.
And you guys won't forget that.
Because that's the vagus nerve and the brainstem right there. And when you open up, it's also been called the mouth of God.
Interesting. I've not heard that before.
So the Atlas bone is like a ring, and it's holding up, the world, our heads, right? And in that ring, there's also a big hole right above it called the foramen magnum, which is the hole that the spinal cord goes through in the back of the skull. And then you have the Atlas, which is a ring. And if this Atlas or the skull is not on right, like if you're off your rocker.
Yeah.
Right?
No,
you've heard
never.
that. Yeah. I've probably been called that once or twice. That moves off his rocker.
Right?
So if you're off, but honestly, if you're off your rockers, which are these little bones here on the back of the skull that sit on top of the atlas, that puts stress on the brainstem and the vagus nerve, throws that fight or flight response off, and then makes this brain not be able to think so clearly.
Yeah.
And then that's why people are called off their rocker.
I think I'm off my rocker right now.
So atlas adjustments are the bomb.
That's probably my favorite adjustment to
For
receive.
sure. Yes.
Yeah. So you talked a little bit about this, but can you expand on the other healing modalities you offer at your practice?
Yes. So I think the thing that flows next into it is the cold laser, because I like to use it in like a chiropractic way. We have two different laser heads that emit photons, red laser photons, into the body. And one of the laser heads is dialed into the nervous system. So we place that on the spinal nerve root.
Okay.
And then we have another programmable head that gets the frequencies of the laser get programmed to specific tissues. So whether we put the program head on the thyroid or on the lung or on the thymus to help with the immune system, or on the kidneys or on the gut, or whether we just put it on muscle or bone, musculoskeletal things, that other laser head is programmed to the specific tissues. So we put one of the laser heads on the nerve that feeds the end organ or the end tissue, and then we put the other laser on the tissue, on the specific tissue. We push play. I say play because that's what it looks like on the laser. We push play, and magic happens.
It does.
It's like magic. So the photons from the laser go into the body, into the tissues, and kind of like how a UV light causes a plant to grow faster, the laser light causes cellular regeneration to happen faster. So it gives damaged cells extra energy to heal and regenerate. It's pretty cool.
I love science too, so I'm always fascinated to hear all of this stuff.
It's called photobiomodulation. So what photobiomodulation is to animal cells, photosynthesis is to plant cells.
There you go, guys.
There it is.
Nice and simple.
Yeah. Chlorophyll, more like borophyll.
No. It's not boring to me, but I'm assuring that your delivery is making it very entertaining for everyone who's listening.
So that's one thing. So we've got the cold laser, and that helps with all sorts of issues, neurological things, pain, all sorts of things. But we also have a hyperbaric oxygen chamber.
Yes, talk about that.
What it does is that you go in this little, I call it my little space capsule. We zip it up, and it sends you through the space-time continuum, and you wake up next Tuesday.
That's fascinating.
No, it's not me. But we go in this little capsule, this little thing, we zip it up, and then we turn on the pumps, which pressurizes this capsule. And then we turn on our oxygen condenser, which puts 95% oxygen into an oxygen mask, and you breathe in 95% oxygen while being pressurized. And what that does is it saturates your blood with oxygen. And oxygen is a very healing nutrient. So when things have extra oxygen, they've got essentially more fertilizer to grow and better nutrients to heal. So oxygen heals tissues faster. So when you saturate the blood with oxygen, you're saturating your tissues with oxygen. And the tissue, an organ that requires the most amount of blood, is the brain.
You don't say.
You don't say. No, I do say. The brain requires the most amount of blood. So if we're saturating the blood with oxygen, then we're also saturating our brain with oxygen, which is the conduit for which the innate intelligence and healing force heals the body. So if you're saturating the brain with oxygen, you're improving your body's ability to heal, not only neurologically, but that same oxygenated blood goes to all of your tissues, whether it's say like diabetic neuropathy where the feet don't heal, you put the oxygen in the blood and their feet start healing. Or whether it's post-concussion syndrome or post-stroke syndrome where their brain needs to do more healing. Or even, can I say this, conditions like cancer have shown that when you oxygenate the body, tumors shrink, because many cancers, not all cancers, but many of them thrive in a hypoxic environment, which means no oxygen or lack of oxygen. So when you saturate the tissues with oxygen, you're essentially poisoning the cancer while at the same time
feeding the other tissues.
Healing the body, right.
Yeah, I've heard it also is very successful with things like Lyme, because the bacteria cannot survive in a highly oxygenated environment.
That is true.
And while we're on the topic of things like this, just to make sure we're clear. We're not curing or treating or diagnosing anything specific. We're just helping support the body so it can do its own magic healing. So tell me this, how about a favorite patient success story?
One more recently, she came in because she had headaches all the time and neck pain, and I was telling her about how the whole subluxation complex works and how it affects the brain and the nervous system, because, shockingly, she had anxiety too, and didn't really want to go outside very much. Because she just didn't like socializing so much. Anyway, and we started literally it was after her first adjustment. She comes in, she's like, I don't know, but there's something going on here, right? And I was like, oh, what's that? She's like, I don't know, but I slept great last night. I don't have this, issue in my neck right now, and I'm not, so my anxiety level's gone down. And it was like on the next day, and I was like, well, happy day. That's how it works.
Miracle of chiropractic,
right?
Y'all. I mean, it's the real deal.
It's amazing. No, this isn't every single time, but a lot of the time.
The potential's there.
Yeah.
I mean, I've been seeing a chiropractor or 2 or 3 or 20 or something like that.
Yeah.
Since I was 19. And as soon as I kind of had full control over my own health care, I was all about chiropractic. If I got a cold, and when I was in college, I would drive home and get my face adjusted instead of taking medication. But I actually hurt myself really badly when I was 19, slipped a disc, couldn't get out of bed. And chiropractic is the alternative to having surgery. I mean, it really can make such a huge difference. And, I don't think it's ever too early. How young is your youngest patient?
A few minutes old. It was my little boy that we had at home back in 2020, Hayden Ray.
Yeah.
He was, that was the youngest, but I've adjusted lots of other newborns and infants, toddlers. Their adjustments are a lot different than adult adjustments. They're more like testing the ripeness of a tomato. Is about the amount of pressure that you place on their little necks up here and their little spines. But honestly, though, the most important subset group of human beings that need chiropractic are the babies.
Yeah, especially C-section babies.
Especially.
If you didn't know that, and you have to have a C-section, make sure you consider at least looking into the benefit of chiropractic for C-section babies.
Yeah,
I wish I would have known that.
There's a lot of trauma on their spine, even vaginal birth, C-section birth, any birth at a hospital, because there's a lot of medical interventions that create an increased stress response in moms that then increase medical intervention. So whether it's the trifecta in the hospital, where it's Pitocin, then the epidural, and then the C-section. That's just kind of how a boatload of births go in our country. But even if we don't have a C-section, even a normal vaginal birth can tend to have a lot of trauma, because the
force.
That's
a lot of force.
The twisting and pulling that OBs put on babies' heads is horrific, and it's horrific. And I always have this like running meme in my head that says, people are like, you adjust babies and infants? And I'm like, you should see a picture of an OB pulling out a baby, and then compared to me adjusting a baby's spine, and there's a meme in there somewhere.
We'll work on that.
All right.
We'll put it in the comments.
It's so simple. Like, it's so gentle. It's so gentle, but at the same time so powerful.
Sure.
Because what's controlling that baby's not only immune system and all their organs, but what's controlling that baby's development, neurologically, physically, everything, is the nervous system. So if you want your babies to be meeting their milestones and be developing properly, then you make sure that there's no interference in the nervous system. And for heaven's sake, we don't poison them with toxicities that not only damage their brains and nervous systems, but also assault their immune systems.
Yeah.
What we do to our kids through healthcare is always, once I discovered the truth about what goes on in our children's healthcare, it boggles my mind.
Yeah.
Can I share a quick story about
Please.
that? All right. So I have my oldest brother is Troy. All right, his name's Troy, and he's 10 years older than me. And when he was, have I ever told you this story?
You've told me a little bit about your brother, but I don't know about this story.
So my mom was 16 when she got pregnant back in 1964. And so Troy's born in December of 64. My mom's 17, but during her first trimester of pregnancy, she developed German measles, which is rubella.
Okay.
And so German measles can have an effect on the baby's development, fetal development. It can cause vision issues, hearing issues, cause deafness, cause heart issues. It can cause neurological issues. And so my brother kind of got a little dabble of all of them. Some babies were just deaf, because there was a lot of babies in 64 called rubella babies. I don't know if that's even PC, if we could call them that.
Probably not.
Probably not. But anyway, that's what my mom said anyway. So Troy's born congenital rubella syndrome. And so he had a hard time hearing, seeing. He had cataracts in his eyes, which at that time they didn't have laser surgery with laser beams, cool lasers like we have. Right. They went in there with scalpels and cut the lens and went in with a needle and pulled out the cataracts. So there's a lot of scar tissue in his eyes. But he always had a hard time, Mom said, he had learning delays and speech delays. And he had to go to a special school, Iowa School for the Deaf, because he was mostly deaf. And he was what was considered legally blind, because his eyesight was very poor. Not blind, so he can see, he can read, but he can't, drive a car.
Right.
So Troy goes to school, and he's got his, he learns sign language and all this. And I remember growing up that Troy also had a hard time kind of like not only communicating, but kind of picking up on social cues.
Right.
And I remember being in the car with him, like if we were going to get pizza or something, he'd be in the back seat rocking like this. And I always thought that was really strange. And I said, Mom, why does Troy like to rock? And she said, I always had to rock him to sleep as a baby, because he cried all the time, all night. Of course. Yeah, he's very colicky. And all of these stories are like clicking in my head, right? I'm just remembering them. And as I go to chiropractic school, this thing called autism starts skyrocketing. It's the social nerve. So we're learning all of these things, and I'm like, that's my brother. That's my brother. My brother has this disconnect too. Holy smokes. My brother's autistic. And that's the reason why he had a hard time picking up social cues and kind of like navigating this world, right? And I was like, oh my goodness. And so this was the late 90s. And then so we never had him diagnosed, because really, what's the diagnosis? What's that going to, it's not going to matter anyway. Not that it does anyway. It doesn't. I'm not going to go down that rabbit hole. But so I'm speaking at an autism conference, because that's one of the things that I'm very much passionate about is autism, because I lived with it in my life, right? So I understand kind of the challenges that people go through. And so I'm at this autism conference, and I'm reading this doctor's kind of biography part, and she's a medical doctor, and she's saying how the MMR shot doesn't work, because it wanes, the immune system, the antibodies wane after, say, 5, maximum 10 years. So you've got like hardly any antibodies, any titer left in your system once you become childbearing age, a woman, right? And so then she mentioned congenital rubella syndrome, and how now most of the women are just as open to attracting rubella as what they did, when they were back in the 60s. And so in her thing, she says congenital rubella syndrome is a medically accepted, and I say that in quotes, cause for autism. And I said, wow, I never read that before. We never had a doctor tell us that before. How come? This is like 2012 or maybe 15 or something like that. And I said, without a doubt, my brother has autism, because it says it right here. Right. And here's the funny part, right? So congenital rubella syndrome can cause autism. Right. And that's wild rubella that is affecting the baby's neurological development in utero, and can cause all these issues, including autism, because their nervous systems are without a doubt in fight or flight response. Due to most of the time, most children, a big majority are born C-section, and all of them are vaccinated. In fact, unvaccinated children, autism is so unbelievably rare. So we've got chemical toxicity, we've got physical traumas, and then, the emotional stressors, keep lighting the fire.
Right.
Exactly. So
yeah. It's a lot on those little guys.
Yeah.
How do people find you?
They find me at vitalwellnesscenter.net.
Oh, .net, guys. Don't miss
.net,
that. We'll put it down in the comments for you.
Yeah, vitalwellnesscenter.net. That's my website. Dr. Dave, DRDAVE, at vitalwellnesscenter.net is my email.
That being said, is there anything about chiropractic, a myth that you want to dispel, something that you think is super important for people to know about chiropractic that they may not know?
Two big questions that people always have because of the stories that have been kind of said out there.
Sure.
So one of them is like, I'll hear the story where like my best friend's sister's boyfriend's brother's girlfriend heard from this guy who knows his kid who's going with a girl who had a bad experience at chiropractic office last week.
So you definitely shouldn't.
Yeah. So sometimes there are people that might not have a very good experience, and that's too bad. But what the studies have shown is that chiropractors have the highest rate of people that are happy with their service more than any other healing profession. So they have over like a 97% like people happy with their results.
Yeah.
So
I love a good adjustment. If you guys have not been adjusted, I really encourage you to either come see Dr. Foss here in Elburn. He's great. He is actually my personal chiropractor.
Shucks. So yeah, if you have a bad experience, just go to another chiropractor. Nobody goes. I'm sure there's probably one of the. Even I like my dentist. People you hear all the time will have like oh gosh, I don't like going to the dentist.
Yeah. And
people don't ever stop with their oral hygiene. Right. If they don't like their dentist, they just maybe pick a different dentist.
Right.
You pick one that you like.
Right.
But you don't stop. You don't throw the whole dentistry profession under the bus.
Let's hope not.
And that's kind of what can happen with chiropractors. People say, I had a bad adjustment. And, they throw the whole profession away. But don't do that. And the other kind of myth thing is that once you start getting adjusted, you have to do it forever. And they'll make you keep coming back. 'Cause you'll get addicted to it, right? You'll get addicted to chiropractic. You'll get addicted to crack.
You might get addicted. If you're like me. But no, not really addicted. I just really have a lot of subluxations. I'm hard on my body and working really hard on healing it and keeping it supported.
Yeah. And
so for me, regular chiropractic is important, and I enjoy the adjustment. Like I probably need one right now.
Yeah, well, you'll get one when we're done.
Oh, good.
Ooh, happy day. So the truth of that story is that no, you don't. You can use chiropractic however you like. You can use it for just symptomatic care because it's good for that. But I think it's best for health optimization. So way beyond the time you have symptoms, because by the time you have symptoms, you could have had a problem for quite some time.
That's true.
So some people choose chiropractic to optimize their health and for their wellness. And so they use periodic chiropractic adjustments to supercharge their immune systems, to de-stress their nervous system so that they have less anxiety. It's to optimize their health and well-being, and really to enjoy life, to get the most out of your life, because that's what chiropractic is really about. It's about life and enhancing your life. Living
a long, healthy, vital.
It's as if I named this place for a specific reason.
Coincidence? I don't know. But yeah, a life full of energy and being able to move and do the things we love to do.
Yeah, it's called quality of life, quality of living, right?
Quality of life. Yeah. Live, not survive, right?
Yeah, live every day of your life. As my social studies teachers told us one time, he used to have these phrases up on the chalkboard where he would chalk. He was left-handed too. I remember he'd write on the chalkboard, and live every day of your life was one of them. I always remembered it. I thought, I like it.
Very good.
Yeah.
Well, if you have any questions about chiropractic specifically, or you want to connect with Dr. Foss, please drop a comment down below. Give us a like, share with your friends and family. We are so happy to have you here. Glad that you had some time today to meet this awesome guy who is an amazing chiropractor and a good friend. So literally to everyone who comes in here. He is full of hugs.
Thank you. Thank you
All
very
right.
much. Yeah, I had a good time.
Yeah.
And I hope your listeners will pick something up from this.
Yeah, for sure. Thanks for being here, guys. Have a good day.